I love my little pediatric population, and they come in for various things. I would say one of the biggest things that they come in for is eczema. And you know, eczema is this, I would call it this genetic problem. You're born into a family that has asthma, pollen allergies, and voila, these kids have this incredible dry, itchy, scaly, rashy skin that nothing seems to help. But putting most of the pediatric population on a really good skincare regimen, like mild cleansers, really thick moisturizers, sometimes a little bit of a topical steroid ointment, you know, very sparingly, and they usually do very well. You know, there's other things with eczema for kids that is important to look at. Number one is the diet, because I find that milk and milk products really can cause a lot of the flare-ups. Sometimes kids have allergies, you know, they're allergic to dust and pollen that triggers the eczema. So it's a multifactorial, I call it disease. And sometimes I work in collaboration with my allergist, trying to figure out what these kids are really allergic to. Really talk to the parent and tell the parent that this can be a 20-year process of trying to keep this skin clear. And that it's every day you need to sort of do something to the skin. I see a lot of parents bringing kids to me for total skin checks, especially if they're fair and if someone in the family has had a history of melanoma. They get very worried. And I usually tell them that, you know, I don't care how young the child is, just bring the child in and we can discuss their skin together. And I usually point out certain moles on the body, what's important as far as a sunblock to use. The only types of sunblock I use in my practice are ones with the mineral-based sunblock ingredients, zinc oxide and titanium dioxide. I use that because those are the two ingredients I find that will give you the best coverage, especially for UVA, and they're less toxic on the body, and they're less irritating. So even my infants, 6 months and older, there are some phenomenal products, sprays, foams, creams, lotions that have the zinc and titanium.